Welcome to all our students. I am Maslinor Ismail. I am in Family Health Unit in Social and Preventive Medicine under Faculty of Medicine. Okay, today we are going to explain or discuss about indices and statistics used in family health. We have three parts in this lecture. The first part, we will explain regarding the indices or the indicators, the definitions. The second part, we will explain regarding health indicators and social indicators, the difference and the reason why we have to use both. And in the third part, we will discuss about gaps, limitations, and other related materials regarding indicators. Okay, first of all, we have to understand that under public health, the aim is to improve the health of the citizen. And second, we have to reduce any inequalities in that population. So in order to do that, we always have to amend the policies. Okay? And to amend policies, you must have factual information. And that factual information is called indicators. Indicators, okay, it is defined as the content of data system. Something that we have to put into a series. We have to have certain methods, okay, and we have to organize the indicators, okay. If we design in a very good manners and we follow and we measure in a very good manners, it will be very beneficial for any illnesses or any problems, health problems, okay, in that population. So the major points why do we need to have indicators? First, because we need to know about the utility of proposed indications. We have to know about how we want to plan, monitor, evaluate at national level, at state level. So we need indicators for that. Second, we need to have indicators for basic subcategories and we have to look at any disaggregations between those indicators. The third is because we have to see whether it's compatible or not with the social, economic concerns and indicators. Okay? And finally, usually, we want to go further ahead into research and development of certain illnesses or disease or health behaviors. And so we need indicators in order to do that. Health indices, remember this word, it's a parameters. Parameters to guide us to know about what is the level or state of health of that population. And if we have a very good indicators, okay, we can quantify, okay, our success, okay, or our achievement in reducing the illness or reducing the bad behaviors or increasing the good behaviors. What is the power of indicators? Okay, power of indicators is when we compare all the indicators with other countries or other states. Okay, over times, between geographic areas, between groups of people, and we focus on certain domains of health. That is for power of indicators. And if we want to have a very good indicator, we have to have high quality data power. Okay, we have to make sure all these will be available throughout the time. Okay, and we have to have the central importance at the health that we want to monitor. So we call it proxy power, and we have to have communication power where there is transparency between one indicator to another indicator. Or one indicator in one population to another population. Okay? What are the bases for health indicators? Okay? First, you can use health indicators that are based on conceptual models. That means you have research, so you have conceptual models. Conceptual models is a model that shows you what are the characteristics that influence health status. Based on scientific research. So once you have a study or a scientific research and you have that conceptual models, you can get indicators from there. Second, you have indicators that is evolving throughout time. Okay. Example, life expectancy. So you monitor the life expectancy in a population. So you see declines or upward trend in mortality. Okay, be it child mortality or infant mortality. Okay, due to, let's say, infectious disease or other diseases. Okay, those are health indicators based on time. And the last one is based on disease, based on certain tragedy. So let's say somewhere a long time ago in 1910, 1920, we have problem with pneumonia, tuberculosis. So at that time, there were many mortalities secondary to those diseases. For the first part, the summary is, you must understand that in public health, because we did not look at personal, individual or patient, we look at population, we cater for population health. So indicators is utmost important in order to maintain and upgrade and decrease the inequality of health. So I do advise you all students to really understand the importance of these health indicators and the relationship between health indicators in public health with the social indicators. Okay, thank you.